Hello and welcome to Office Hours, where I answer your questions about weight and weight medication. I'm Dr. Meghan. I'm a board certified physician in internal medicine, lifestyle medicine, and obesity medicine. And this is really important because I actually prescribe these medications all the time. I actually talk to patients about their weight all the time. I've helped hundreds of patients lose weight, and I'm here to help you too. So if you're confused about your weight, if you have questions about weight medications, and if you want medically based answers to your weight questions, you are in the right place. Let's get started. Thank you so much for all your excellent questions. If you have a question afterwards, you can definitely put it on this video or another video, and I will add it to the list. And as always, as a disclaimer, I can't answer personal medical questions because I'm not your personal doctor. So if your question is a little personal, I might change a little bit to make it more broadly educationally helpful for people. So with that said, let's get started. First question. I haven't started my injections because family and friends are against it. I don't work out, so I can't say I was exercising. I wish the people around me were more supportive of my decisions. Thank you for sharing that. I chose this, I wanted to talk about this today because I think this comes up for a lot of people. And, our family and our friends are always going to have their own opinions about what we do, what we don't do, what they think that we should be doing. But I think in the realm of weight, medications for weight, working out, like all these other things, it seems, for some reason, it seems to bring out everybody's opinion. And so I definitely hear you because it's really hard for people if their family and friends aren't on the same page. But sometimes, one of my first questions with people, if they are telling me about this, if I have a patient in the office and they're saying, my family, my friends aren't supportive, one of my first questions is, do they need to know? Right? Like, why do they need to know? It's your medical information. Like, they don't need to know if you're taking thyroid medication, right? They don't need to know if you're taking a beta blocker. So they might just not need to know, and it might just be none of their business. And that's certainly an option for you. But let's say for whatever reason they are going to know, or you want to share this with them, you always, people are allowed to have their own opinions, right? So your family, your friends, they're allowed to disagree with you. And you're allowed to get whatever medical treatment that you want. So you just have to know that if you're going to share this with people, that it doesn't mean that they're necessarily going to agree with you, and that's okay. Sometimes we just have to let people disagree or be wrong about what we're doing. And also, I think it always also comes down to like your reasons, like what's more important to you. Is it more important to like keep everybody happy and not be on the medication, or is your health more important and it might be okay that people aren't happy? But also I would say you could not take the medications and they could still be not happy with you. So it's kind of like the only way you win is if you take care of yourself. Do you know what I mean? So I would strongly advise anybody in the situation to, of course, let your family and friends have their own opinions, but don't let those opinions be harmful to your health. And also, this comes up a lot. Sometimes people's family, their friends, they don't want them to lose weight because they'll eat differently, or they won't want to do the same things, or they'll be at a lower BMI and maybe they had a very similar BMI to the rest of their family and friends to start. Or there's so many different reasons. And then also this comes up for people all the time, is just be prepared when people lose weight. Be prepared, because a lot of people, for whatever reason, they feel like now's the time where they can just share any opinion that they had about your weight before and your weight now and what are you doing, and I'm worried about you, or this is not a good thing for, like, people just be prepared for people to be more giving of their personal opinions when you've lost the weight than they might be when you hadn't lost the weight, if that makes sense. For some reason, people are just a lot more prone to sharing, invited or not, whether their advice, opinion, whatever has been asked for or not, it just usually comes out a lot more. So just be prepared for that. But always, I think the primary focus, what I want to tell my patients is, this is your health, this is your life. So you get to do whatever you want. And other people get to feel about that how they want. But do you really want that? Do you want that to interfere with your actual physical health or not? That's the real question. So good luck with that. And thank you for sharing. I know a lot of people are struggling with that. So I think that's very, very applicable to a lot of people out there. Okay, question number 2. I have a question. Does Zepbound help anxiety? That's a great question. I would never prescribe Zepbound for anxiety. Zepbound is going to help with a lot of things. For some people, it might make their moods better, but it's never something in thinking about all the off-label uses. That's not one that I would, provided that you could prescribe it off-label and it was easy to do so. That's not one of the first ones I would be thinking of. I probably wouldn't, I would not prescribe it for anxiety. I will say that a lot of times people's moods get better with the Zepbound or any other GLP-1 because they're losing weight, they're feeling better, they feel like they can do more, maybe they're going to the gym more. So I would say for the vast majority of people, their mood improves. Sometimes as patients lose weight, other things come up for them. So maybe they're getting like more attention than they're used to, or they're getting more, like they're dating more, or there's other things, they're having more interactions with people in a way that they may not have before they had lost the weight. And so sometimes that can bring up a lot of other things for them. It's not necessarily anxiety from the medication, but anxiety that is caused by these situations that are coming up now that they've lost the weight. But as I said, there is, and I've made videos about this before, there are times when the GLP-1 medications can affect mood. So it doesn't happen a lot in my experience, but it certainly can, and that can be mild or it can be severe. And there is a warning on the GLP-1 medications for that some people can, in rare cases, have very severe mood changes. So think about if I have a patient who's coming in who feels more anxious, those are the, always I'm going to check and make sure there's nothing else going on, that they're not anemic, that they're not dehydrated, that their blood sugar isn't like, there's a lot of things that can mimic anxiety. So I always want to make sure I'm not missing that. And then usually the Zepbound is not going to cause anxiety, but it could bring up other experiences that could be anxiety provoking. But then every once in a while, there is that rare case where it is going to make moods worse. So if anybody is, if that is coming up for people, I would strongly encourage them to talk to their prescribing physician to kind of go over what's been going on with them so you can get to the root of the problem and go from there. But thank you so much for that. Excellent, excellent question. Next question. I am a 67-year-old woman. I started Mounjaro mid-range dose at 235. At 5'6", I lost 70 pounds over the first year and have stabilized at around 160 over the past year and a half. I know this is fantastic and I look and feel great, yet I would like to get my BMI to a normal, non-obese range. Would you suggest upping the dosage? So I've just done some calculations at 5'6", and 160. This is a BMI of 25.8. So, and I have made some videos about this in the past, so I would definitely watch those two I think it was in another office hours where we talked about calculating what I think about when calculating your, ideal body weight or goal body weight. When you start to get closer and closer to your goal, your original goal, it becomes more of a gray zone. So I like to think about, yes, getting the BMI lower is very important for health for many reasons. But also, when you're getting close, it sounds like this person has been stable. If I have a patient and they have a BMI of 25 or 26, they're still in the overweight category. They're 24 is really where the green zone starts to be. But I think this is also where I want to think about, what has their weight history been? Like, is this somebody who has always been traditionally, 160 was pretty normal for them, or maybe they were 130 or 140 or 160 is the lowest they've ever been in their life. So I always want to take into consideration their genetic heritage. I want to take into consideration their lifestyle as well. So if they're on a stable dose of their medication and they haven't really done anything in terms of changing how they eat or changing how they exercise, that's something that I think is definitely worth optimizing as well. But also, if they're not at the highest dose of the medication, I think it's always, if somebody's been on kind of a mid-range dose for a long time and they're coming to see me, I'm always wondering, well, why aren't you up at the highest dose? Because the medications are dose dependent. So if they're just at that dose because they felt like this was where they wanted their weight to be and now they want it lower, like there's a lot of reasons why people could be on that dose. But I think if I had like a new patient who comes to me and they're not maxed out on the dose, and of course we're talking about all these other things, but that's somebody that I would also strongly consider increasing their dose, as long as they weren't on that dose because they had issues at a higher dose, like side effects that they really couldn't tolerate. Usually my goal is to see where is somebody going to end up once they get to that highest dose. The times that I wouldn't do that would be if they've already lost all the weight that they wanted to lose and we feel like they're at a really happy, healthy place, or they're having significant side effects. So that's really the conversation around if I had this person who came in and they were in the overweight category now, but also weren't at the maximum dose. Those are just many things to think about. Again, not personal medical advice for this person, but that's kind of just to walk you through what the clinical reasoning would be in terms of where I would go. Hello, I had gastric sleeve surgery in April 2023 and basically did not lose all the weight I was supposed to. I have PCOS and my doctor just approved me for Wegovy, but I'm scared of the side effects. Is it safe to use these shots even though I don't have a gallbladder? My PCOS has been an issue for me since I was 18 and I'm turning 40 in June. Not looking for a quick fix. I want a life change. I'm always tired. Will I still feel this way on the Wegovy shot? Okay, this is a great question. So definitely people who have had bariatric surgery can really also benefit from medications like the GLP-1 medication. So they work very well together. So if somebody had a good response, but maybe not the ideal or hoped for response with the gastric sleeve, certainly that would be somebody that I would consider, thinking about a GLP-1 medication as well. In terms of the, is having a gallbladder, do you need to have a gallbladder to be on these medications? No, you definitely don't. And certainly if people have their gallbladder removed, sometimes they can be left with digestive issues. That's just one thing to think about. Did somebody have a lot of digestive issues after they had their gallbladder worse? Because as we know, that is one of the main side effects of these medications, is digestive issues. So if they did, I would want to tread lightly, but it wouldn't be, a hard stop in terms of this person could not be on the medication. And in some ways, it is more helpful because then I know they won't have any gallbladder issues, right? Because it's gone. So that's nice in a way, but you just want to make sure that their digestion is functioning well. And then people with PCOS often do very well with these medications because PCOS in itself can limit weight loss efforts for sure. So I would say if somebody is worried about side effects, my advice is always, I always go over all the side effects, but minimum, the from the smallest to the largest and the scariest. And then it's really a risk benefit discussion with the patient. But I do feel like you never know until you try. And the results are very they vary widely. Some people have no side effects. Some people have all the side effects. Most people land somewhere in the middle. I could say personally for me, I can probably count on one hand the number of patients who have stopped the medication because of the side effects. I think that even if you do have side effects, there's always ways usually ways to work with your body, work with the medication to make it work. And it's often just giving yourself a little bit more time for your body to get used to the medication. So I can't promise anything to people. I can't promise that they won't have side effects, but I usually feel like it's definitely worth a try. Unless somebody's coming to me and they've had a history of really bad GI side effects. I sometimes have patients like this. They've had a lot of issues with like IBS or very difficult GI issues in the past, and they've gotten everything settled and they really don't want to mess with it. That's a patient that I am not going to start with a GLP-1 medication. I would probably start an oral medication instead if they're a good candidate. But you just never know until you try. And I think for a lot of people who would qualify for these medications, it's definitely worth trying as long as you're seeing a clinician that you really trust and can monitor you and you can be in touch with if you do have those side effects. So what a great question. Thank you so much and good luck. That's going to do it for today. Thank you so much for watching. If you have more questions afterwards, you can definitely leave them on this video, leave them on another video. I will add them to the list. And if you want to work with me directly, I do work with people around the world on the non-medical aspects of their weight loss as well as a life coach. So I'll leave all that info down below as well. Go ahead and subscribe to my channel if you're not subscribed already, because it's the place for medically based answers to your weight questions. Again, thank you so much for watching, and please be well.